Continuing from the previous video today, I'm going to walk you through 5 simple but powerful stretches that you can do right at home. Let's get started. 5 safe and effective home stretches for sciatica relief. Do you remember the last time you stood up after a long day sitting in front of the computer and let out that little groan because your back was aching? I remember, not just because I've felt it myself, but because I see it every day on the faces of hundreds of patients over 50 who walk into my clinic. You see, we don't grow old because of our age. We grow old because we stop moving. And your sciatic nerve, it's like a violin string. If it's not kept flexible, it tightens, it cracks, and it starts to make painful sounds no one wants to hear. So today, I won't give you medicine. I'll give you 5 gentle movements. Little gifts you can give your body every single day. No gym needed, no fancy equipment, just 10 minutes and a little bit of trust. Stretch number 1. Knee to chest stretch. What it helps relaxes the lower back, reduces pressure on discs and the sciatic nerve. How to do it. Lie on your back, pull one knee gently to your chest with both hands. Hold for 20 to 30 seconds, then switch legs. Note, if you feel sharp pain shooting down the leg, stop. We're stretching, not straining. Stretch number 2. Piriformis stretch. What it helps loosens tight muscles in the glutes, a common cause of sciatica. How to do it. Lie on your back, cross your right ankle over your left knee. Grab your left thigh and gently pull it toward your chest. Hold for 30 seconds. Switch sides. Pro tip, try doing this in bed in the morning. Soft, slow, like easing your body into the day. Stretch number 3. Cat-cow stretch. What it helps improves spinal flexibility, relieves nerve pressure. How to do it. On hands and knees. Inhale, arch your back. Lift your head. Cow. Exhale, round your back. Tuck your chin, cat. Repeat 5 to 10 times. Reminder. Breathe deeply. Each breath is a gift to your spine. Stretch number 4. Seated hamstring stretch. What it helps stretches the hamstrings, the path of the sciatic nerve. How to do it. Sit at the edge of a chair, extend one leg forward with the heel on the ground. Lean forward slightly, keep your back straight. Feel a stretch in the back of your thigh. Hold 30 seconds. Switch legs. Tip, don't round your back. Hinge from your hips, not your neck. Stretch number 5, standing side. Stretch. What it helps opens up space in the hip area, giving your sciatic nerve room to breathe. How to do it. Stand tall, raise both arms overhead. Lean gently to one side. Hold for 20 to 30 seconds, then switch. Where to do it. In the kitchen while waiting for the kettle to boil. You don't need a yoga studio, just a little presence. I tell my patients to do these stretches every morning and every night, not to treat pain, but to nourish healing. Movement is medicine. But like all medicine, it only works if you take it every day at the right dose. I know, sometimes the pain makes you want to do nothing at all. But my friend, if you don't move because it hurts, you'll keep hurting because you don't move. Start with just one stretch, 30 seconds. And you'll begin to feel something beautiful. Your body, though tired, is still waiting for a small apology and ready to forgive. In the next part, we'll explore how your daily habits affect sciatica after 50. The way you sit, how you stand up, how your mattress supports you, and all the small things that quietly squeeze your sciatic nerve every day. If you've made it this far, you're already doing amazing. Let's keep going, because health is a journey no one else can walk for you. What kind of lifestyle helps prevent sciatica from coming back? You know, the hardest part after healing pain isn't the treatment. It's making sure it doesn't return. I once told an older patient, surgery injections, even stretching, they're just the beginning. The way you live every day, that's the real long-term medicine. Imagine this, your spine is like a musical instrument. If you leave it leaning crooked against a wall covered in dust, even the most expensive instrument won't play anymore. Your body is the same. It needs care in the little things you do daily. 1. Relearn how to sit because you've likely been doing it wrong for over 20 years. Most people over 50, especially office workers, sit 6 to 8 hours a day. But no one ever taught us how to sit in a way that protects our spine. Just remember these 3 simple rules. Always keep your lower back touching the chair. Don't lean forward. Your knees should be level with or lower than your hips. Every 30-40 minutes, get up and walk around a bit. 2. Sleep the right way because your spine doesn't sleep when you do. A lot of my patients wake up with back pain. And the culprit, a mattress that's too soft or a pillow at the wrong height. The ideal setup. Sleep on your side with a pillow between your knees, or on your back with a small pillow under your knees to reduce arching. Choose a mattress that's not too soft, not too firm, just supportive. You don't need to spend thousands on a mattress. Just remember your spine needs to rest properly too, just like you. 3. Walk like you're teaching your body balance again. One of the most powerful prescriptions I give is walking slowly. No need to rush. No need to go far. Just stay consistent. 10 minutes in the morning, 10 minutes after lunch, 10 minutes before sunset. Each step is like telling your body, I'm still here. I'm in control. I'm healing. 4. Don't let stress be the reason your body tightens up. Emotions have a shape. When you worry, your shoulders tense. When you're angry, your back stiffens. When you're sad, your whole body slumps. I've seen people with strong, healthy spines still stuck in chronic pain simply because they never learned how to relax their mind. Try this. 5 minutes of morning mindfulness. Some soft instrumental music before bed. And one small whisper of gratitude to your body, even if it's not perfect yet. 5. Shift your lifestyle instead of spinning in circles with pills and treatments. Ask yourself, are you lifting heavy things the wrong way? Carrying a bag on just one shoulder every day? Looking down at your phone for 2 to 3 hours each night? Small habits repeated daily, that's what silently builds up to chronic pain. You might be thinking, Doc, I can't change everything all at once. And I get it. I've never expected anyone to make giant leaps. All I hope is that you start with one small thing. Adjust your chair. Take a 5-minute walk after dinner. Stretch your back each morning. Or simply stop blaming your age. Illness is part of the journey. But lifestyle, that's the steering wheel. It decides where you're headed. So have you figured out which small thing you'll change first? In the next section, I'll talk about when you really need to see a doctor and which tests or scans are truly helpful. So you don't waste money or delay the care you actually need. You've already done great by listening this far, and I truly believe your body is smiling back with every bit of attention you just gave it. When should you see a doctor, and what tests should you ask for? There's something I've learned after 30 years of being a doctor. People don't avoid hospitals because they don't feel pain. They avoid them because they're afraid of what the pain might mean. I remember an older gentleman, Gerald, 70 years old. He came into my clinic with a wooden cane, eyes cast downward, and softly said, Doctor, I've actually had this pain since last year, but I thought maybe it'd go away on its own. He's not alone. There are many like him, especially men over 50. They're used to toughing it out, to suffering in silence. But your body doesn't need you to be strong. It just needs you to listen at the right time. So, when is the right time? Don't worry, I won't overwhelm you. Just remember these 5 signs. If you notice them, don't wait, go see a doctor. 1. Pain lasts longer than 6 weeks with no relief, even after rest and light exercise. Mild sciatica may heal on its own, but if it's been a month and you're still struggling to walk, sleep, or function, it's no longer just temporary. 2. Clear muscle weakness in one leg. If you notice Trouble lifting your heel or toes. Can't stand on tiptoes or climb stairs. One leg looking smaller or weaker. It could mean your nerve is severely compressed, and the damage might become permanent if left untreated. 3. Loss of bladder or bowel control. If you suddenly can't hold your urine or bowel movements, get to the hospital immediately within hours. It may be a sign of cauda equina syndrome, a surgical emergency. 4. Night pain, fever, or unexplained weight loss. This isn't just mechanical pain. It might indicate a spinal infection, a tumor, or an underlying illness. These are rare but must be ruled out. 5. The pain is changing how you live your life. If you've stopped going for walks, avoid social events because you're afraid to sit too long, or find yourself retreating into fear that it might come back. Even if it's not an emergency, it's time to see a doctor. Not to overreact, but to reclaim control over your body and your spirit. So what tests should you ask for? Good news, you don't always need scans or expensive procedures. Depending on your symptoms, your doctor might recommend 1. Lumbar spine X-ray. Helpful if they suspect bone spurs, spinal narrowing, or slipped vertebrae. Quick and affordable. 2. MRI. Magnetic resonance imaging. The gold standard for checking sciatica. It shows herniated discs, nerve compression, infections or tumors. If your leg pain won't go away or muscle weakness is present, this is essential. 3. Blood tests CBC, CRP, ESR to rule out infection or inflammation. 4. EMG electromyography. If your pain has lasted months and the cause isn't clear, this test checks how well your nerves are working. I know, going to the doctor can feel scary. You wonder, will they say I need surgery? Will it cost a fortune? What if they find something serious? But my dear friend, the biggest fear isn't finding out what's wrong. It's not knowing and missing the window to treat it in time. I've seen patients who waited too long. They still recovered but lost some function, some freedom. You don't need to go down that path. All it takes is listening to your body just a little sooner, booking that one appointment, asking that one brave question, what is my body trying to tell me? In the next chapter, I'll share a very special story about a woman who once couldn't walk 10 steps, but regained her life just by understanding her pain and acting at the right time. Because sciatica isn't the end of your story. It might just be the beginning if you let it. Stay with me. This journey isn't just about your spine. It's about how you choose to live the years ahead. Recovery story. From wheelchair to walking 3 kilometers a day. Let me tell you about Linda, a 67-year-old woman I'll never forget. She didn't walk into my clinic. She rolled in a wheelchair. Linda was a retired school teacher. Before the pain took over, she used to walk her grandkids every afternoon, tend her rose garden, and always said proudly, "I'm still pretty spry, doctor." But then, one morning she couldn't get out of bed. A sharp pain shot from her lower back down her right leg, like a cold knife had sliced through her hip. She tried to rest, used pain patches, took over-the-counter meds, followed some stretches she found online. But the pain didn't back off. It slowly stole her freedom. Within just 3 months, she couldn't stand for more than 5 minutes. She couldn't bend over to tie her shoes. She couldn't sit in a car for more than 15 minutes without her leg going numb. She looked at me, eyes watering, and said, "I'm not afraid of the pain, doctor. I'm afraid I'll never live a normal life again." So we started over slowly. I explained the sciatic nerve, the common mistakes people make, and most importantly, the possibility of recovery if she stayed patient and believed. Week 1. She did just 2 gentle stretches on her bed morning and night. No pushing, no rushing. I told her, you don't need to try harder. Just try consistently. Week 2. She started walking indoors 5 minutes at a time. She said those first steps felt like walking on nails, but she kept going. Week 3. She added cat-cow stretches to open her spine, placed a pillow under her knees at night, and most importantly, she began to believe she could come back. We added physical therapy, 1 precise anti-inflammatory injection, and 20-minute morning walks. No surgery, no heavy meds, just proper guidance repeated daily. After 3 months, she sent me a message with a photo, her and her grandson walking in the park. Her caption brought tears to my eyes. Today, I walked 3 kilometers. No wheelchair, no cane, no fear. Thank you for not just treating me, but believing in me even when I didn't. You see, Linda wasn't special. She didn't have perfect genes. She didn't have luxury insurance. She didn't go to a fancy gym. She had one thing, a tiny belief that her body was still worth loving. Recovery isn't a miracle. It's what happens when you repeat the right things, especially on the days you want to give up. If you've made it this far, and ever thought I'm too old, maybe it's too late for me, I want you to think again. Linda once sat in a wheelchair. Now she walks 3 kilometers every evening. And you're still moving, still listening. And there's so much you can still do for your body starting today. In the final chapter, I'll help you tie everything you've learned into one simple, powerful habit. Not just to end pain, but to live well and live free after 50. Let's keep going. This final step isn't the end. It's your beginning, conclusion, and today's action. Don't wait until it's too late. Dear friend, if you've made it this far, I believe something about you. You're not just someone who listens passively. You're someone who wants to live differently, healthier, stronger. And I want to congratulate you for that. Because true change doesn't begin with a prescription. It begins with a decision. I've met hundreds of people with sciatica pain. Some went home, chose to rest and wait. Some rushed into surgery without fully understanding their condition. But there were also those who chose to understand their body. They read, they asked, they listened, and then they acted. Action doesn't have to be dramatic. You don't need to spend 2 hours at the gym every day. You don't need to throw thousands of dollars at machines or fancy therapies. All you need is 5 minutes of stretching in the morning, a proper sitting posture at your desk, one more glass of water, one more step even if it still hurts. Because here's the miracle. Your body always wants to heal. You just need to stop getting in the way and start walking alongside it. Maybe today all you did was learn about the sciatic nerve. But tomorrow, if you stay consistent, you'll learn more about yourself, about how long you've neglected your body, and about the quiet, incredible ability to heal that still lives in every breath you take. Today's actions, small but real. Right after this video, I want you to do 3 things. 1. Stand up and walk for 3 minutes. Just around the house to remind your body, I'm still here and I'm starting now. 2. Apply a warm compress to your lower back for 15 minutes. Not just for pain relief, but as a message to your nervous system, I care about you. 3. Choose one simple stretch I've shown and do it today. It doesn't need to be perfect. It just needs to begin. And if this video helped you in any way, please share it with a loved one who might also be quietly suffering. One simple share can change a life. I'm Dr. Ethan Greenwell. I'm 60 years old and still learning every day from my patients. If you need me, if you have questions, if you want me to walk with you on this journey, leave a comment below. I read every single one. Because I believe sometimes all it takes is one person believing in you to help you believe in yourself again. Don't wait until it's too late. Pain doesn't vanish on its own. But if you understand it and start taking action today, you won't just get healthier. You'll come alive in the way you were always meant to. Thank you for walking this journey with me. I'll see you in the next video, where I'll guide you through 3 of the most effective stretches to relieve sciatica pain in just 10 minutes every morning. Don't forget to subscribe. Because health after 50 is a journey, and we're walking it together.